Okay, hi everybody. So today I'm going to be talking about the examination of drug resistance to ribociclib and CDK6 mutants. This basically is focused on metastatic breast cancer treatments. Breast cancer is the second most common cause of death in women from cancer in women in the United States. In 2018, approximately one new case was diagnosed every 18 seconds. Metastatic breast cancer is a type of breast cancer that spreads to an area farther from where it started, so like to a different spot in the body. The spot that it spreads is called the metastasis. Metastatic cancer in general has the same definition. This is just specific to breast cancer cells. The 5-year relative survival rate is 30% in women and 19% in men. 6% of women have metastatic breast cancer when they're diagnosed. And the primary reason for the cancer relapse is the development of a multi-drug resistance, hampering the treatment and the prognosis. Ribociclib is used in the treatment of human epidermal growth factor 2 receptor negative, so HER2 negative, and estrogen receptor positive, ER positive treatment. This is just a picture of the HER2 negative metastatic breast cancer. That's kind of what it looks like. Ribociclib is also called Kisqali. It's an effective CDK6 inhibitor, and patients are having tolerance issues. Basically, it follows the same signaling pathway as EGFR, and they're just building a tolerance to it, and it's not attaching the same way. So that's kind of like where all the focus is going into. CDK6 inhibitors are drugs designed to inhibit cell growth and the growth of cancer cells. All right. Oh, and ribociclib's a orally bioavailable drug, and it's really effective when it's used in combination of non-steroidal hormone inhibitors. But I'm not going to really talk about that much. So resistance to ribociclib and CDK6 mutants, the project overview. This is that over there in the corner is the structure. We would basically be designing a drug where the CDK6 mutant, in my case R22H, has minimal to no damage to the wild type. It follows a computational research procedure that we've all gone over many times, and it's in here a little bit. We would go through the structure review, protein docking, different virtual screenings. We'd go through the different data banks, and we would look for the best fit. Basically, we would be using the results to find that top 10% of each category, and then doing experimental research similar to the research that we did, because this does follow the same pathway, similar to that research, so that we can basically, hammer out which ones are the best. We'd be looking for a low IC50 in the mutant, so you want high potency against the mutant, and we'd be looking for a high IC50 in the wild type, so that it wouldn't really damage the wild type, the cells that the wild type is attaching to. Preservation of good cells. So the research design, like I said, we could be using Maestro virtual desktop capabilities, the protein docking, HTVS, and drug-drug interactions with the existing drug mutant and the experimentally obtained drugs. IC50 values and docking scores would be compared, and I'm going to talk about that more on the last slide. The computational methods are really efficient. It's really not too hard to train somebody. As you can see, we learned it in a semester. It's not too hard to train somebody. It's cost effective, and it can get kind of solutions fast. It has a high success rate, and like I said, shortens our research time. Because it greatly shortens our research time, it further decreases the cost, and it allows for more focus to go into the product that's already expected to work. So those top 10 that we find at the end. This revolutionary approach leads to more outcomes and holds potential to predict mutations in the future, and it allows for the initial research team to begin developing the next drug before the mutation can really hit, because it can kind of predict in advance. And this is my data analytics. Through the computational methods, the docking scores would be discovered, and in this case, this is for my bioinformatics paper, student's paper, and as a replacement for ribociclib, you can see here that our docking scores are not super great. So because the docking scores went up, we would not focus on the mutant, and we'd mostly focus on the wild type. And in the best outcome, though, we would want a high IC50 for the wild type and a low IC50 for the mutant. That's not really the case here. And because we focus more so on the wild type experimentation, a little bit different. I didn't read a whole lot about some of that, but new research has been showing combinatory therapy has been the best bet. So instead of using just ribociclib, researchers are trying to target the EGFR signaling pathway specifically, and that wasn't in this. That's it. Any questions? Okay.
I have a question. So another
I was like, wow.
breast cancer is called the triple-negative cancer. Can you kind of give more?
I'm sorry, can you say that one more time?
Another hard treat breast cancer is called the triple-negative breast cancer. So do you have some information?
A treatment.
Triple-negative. So that is
Triple active. Oh. Triple negative. Thank you. I'm so sorry. I've had a very long day, as I'm sure we all have. But so for triple negative breast cancer, I don't have a lot of research in this about that. I would assume though you could probably use ribociclib with other like EGFR targets to, you know, go all at once. I mean, this research focuses on negative positive. So yeah. So I would say you could probably use this to target your HER2 negative, but you'd have to use another treatment method, you know, for the rest of the other targets. Any other questions? Thank you.
I'm going to repeat them all.